Hey, today we're going to be talking about physician assisted suicide, which I will refer to as PAS today, just to save a little bit of time while saying that. So, first things first, let's define a few things. Suicide is just when someone wants to take their own life for whatever reason. Euthanasia, which is often related to PAS or heard in the same setting, is when a doctor eases a patient who is suffering from a terminal illness. It's an ailment for which there is no cure, something that they are close to death anyway, and it just aids. It's more of a mercy, easing into the death that is already occurring. A definition for PAS by the World Medical Association is knowingly and intentionally providing a person with the knowledge or means, or both, required to commit suicide, including counseling about lethal doses of drugs, prescribing such lethal doses, or supplying the drugs. While they define that for us, they do not, the World Medical Association makes it clear in other articles that they do not support such practices. While euthanasia might be confused with PAS sometimes by some, I wanted to just clarify the differences. Euthanasia is a merciful thing for someone who has a low quality of life, who is suffering from something that there is no cure for, something that they will not recover from or get better at any point. Whereas physician-assisted suicide can be someone who is depressed, who is looking for, in my term, I like to say it as a permanent solution to a possibly temporary problem. So it is something that can be treated. There is potential for it being healed in the future. That's how they're different. It's something that curable versus not curable. Why is this important as a topic? Suicide rates in America are rising each year. Studies have shown that one in every 7 people suffering from depression successfully take their life each year. And now that we've established kind of a link between depression and suicide, the National Institute of Mental Health has shown in a survey that a common factor in people that have suffered from depression or are suffering from depression linked to suicide, it's an overwhelming sense of sadness, hopelessness, or worthlessness. Alternatives, how can we treat this other than PAS? So there's a lot of modern day medicine out there. I personally work in a pharmacy and have filled many prescriptions for anxiety and depression. I've even talked to my pharmacist, Haley, about it, and she says that she, in her personal experience, has noticed that patients that take medicine for anxiety and depression, if they take it as prescribed, how they're supposed to, that a lot of people respond pretty positively, that the medicine that we have today is pretty effective at coping and dealing and treating the symptoms of depression. So there's also cognitive behavior therapy as well as interpersonal therapy, which develops a better attitude about your surroundings with a psychiatrist, be it addressing issues, identifying problems, and working to resolve things like that. So now we can move on. Now that we have a little basis, we can go on to the issue of legalizing PAS as a whole. So research has shown that patients who are suicidal, if they are given some of the therapy that we listed above, medicine, talking to a psychiatrist, that kind of thing, if they go through some form of rehabilitation before actually seeking out PAS, that the likelihood that they will still seek a doctor in ending their own life is drastically reduced. And again, that research comes from a company that focuses on mental health and things like that. Also, a practicing medical professional named Dr. Maria Gabriel, she wrote an article entitled The Right to Life or the Right to Death. And in that article, she mentions that her fear is not that people are just going to jump on this as a solution to their problem. She's not concerned about a skyrocketing introduction of suicide. She says that her main fear is that it opens a door, a slippery slope for the medical field that she worries would incrementally get worse over time, that the sanctity of life would no longer be respected, and that, she quotes, a system that does not have clear-cut boundaries may be open to abuse. And she thinks that the harm that could come from this far outweighs the benefit or any benefit of it. Speaking of doctors, for generations, doctors have had to swear under the Hippocratic Oath before they're given their license to practice medicine. And in that Hippocratic Oath, it states, I will apply dietetic measures for the benefit of the sick according to my ability and judgment. I will keep them from harm and injustice. This is the important part. I will neither give a deadly drug to anybody who asks for it, nor will I make a suggestion to this effect. And that states pretty clearly that PAS would go directly, it would fly in the face of the Hippocratic Oath under which doctors are sworn to practice medicine. So obviously that's not ethically, morally something that should be legalized in any way. To add to that, the healthcare system that we currently have is set up to rely on doctors to make the difficult decisions about healthcare and the treatment that patients receive. And if PAS would be legalized, it would kind of take the control out of the doctor's hands and put it into the hands of a patient who may not be mentally stable, who is obviously probably suffering from depression, like we talked about. So it's kind of taking the education and training that the doctors have and kind of putting it to the side, saying that the patient should have more of a voice in using the judgment of the patient instead of the professional that swore that they would use their judgment, not the uneducated patient's judgment, in deciding a treatment for them. In an article published by the New England Journal of Medicine, it echoed the opinions of physicians in the state of Michigan that said pretty unanimously that they would not object to the legalization of PAS, but due to their personal morals and beliefs that they would refrain from actually participating in that. And so I ask you, if doctors are saying, regardless of its legalization, they are going to choose not to do it because of their ethics and morals, why would we legalize it, given that it goes against every bit of training that we've given them? So in conclusion, it is an important topic. It is an issue in today's society, and we should not be using the knowledge, medicine, and technology that we developed for today. It was developed to save and improve lives. Why would we use that to end lives? It should not be legalized, and I hope that after this speech you agree with me. So thank you for your time.